This year's conference theme is on patient engagement, and what that means to me is bringing in non-traditional stakeholders into the picture outside of the patient and provider. So that means, social workers, case managers, etc.
Embracing health does not mean that we just focus on our own individual physical or mental wellness, but really it has to do with, as we move into business in the future, how do we take care of society as a whole? How do we make sure society is healthy?
If health care is properly coordinated and delivered, people will have better health as long as we also pay attention to the environment and to lifestyles.
Last year I also helped with this conference, and both years were really great in learning more about the healthcare industry and specifically how Boston thought leaders are working to do different things around healthcare and make sure that we're pushing those future trends.
So I dream of a time where we will geolocate you in healthcare, you will check in from home, you will co-pay from home.
I think the idea of service recovery that Dr. Boise talked about today was really something for me to think about. What's the patient's experience like? What are users' experiences like? How can we make it better so their service is better?
My favorite part about the conference today was the panel on molecular diagnostics and personalized medicine as it regards to the patient. I have a background in molecular diagnostics, and I just felt the issues raised really are relevant for us as we move forward in the future. How we treat people based on their own genetic makeup, how we treat people based on their own unique disease, and how we pay for it as a society.
I think going forward in healthcare industry, the players that start thinking about consumer health rather than healthcare will provide exactly what the patients need and want rather than just managing their disease or condition.
Time for one last question.